All right, everybody, we're gonna do our exam review real quickly. Excuse me, I'm gonna share with a PowerPoint. The study guide everybody should have, right? Did everybody look at the study guide? Yes? Okay, good. And I'll share with you my exam review. All right, so the first thing we talk about, the several chapters on this exam. Please make sure you've read them and you're well versed in them. 6, 7, 8, 11, 12, 25, 26, 27, 14, 15, 16, 17, and on and on. All right, so we have a lot of chapters we're covering here. All right, next we look at community. Remember, community refers to the people, the place, and the function of an area. When we're looking at the dimensions of people, our community health nurse can access data from the following sites. When we're looking for the dimension, okay? We can look at census data, tourist bureaus, civic groups, and churches. The dimensions of the place would be measured with like things like maps, newspapers, and the local housing office, right? And we could also see the function with our libraries, our police stations, our welfare agencies, and our state departments. Okay. So important content on here, know what refers to the dimensions of a community. We also know what libraries do for us and the dimension of place and where we see at a community assessment. All right, here's a little circle. What we know about health and community, there's lots of different parts to it. So you're going to look at all the categories, which are politics, education, recreation, economics, religion. So when we're looking at a community, we're going to make sure we're looking at all those different pieces. We talked a bit about active and passive partnerships in a community. And just like it says, active means that people are going to be actively involved in it. Passive is going to be where we have just something happening that's kind of passive. So like creating a new park is passive. Providing a vaccine clinic is passive. Partnerships with another community. A business that provides low-cost snacks to an after-school program is going to be one of those active ones because it's a business that's doing something more than just for itself. We had a chapter on data collection and data generation. Nurse performs data gathering and data generation. Data generation is going to be where we take our stuff and we identify data that we can't just look at and see. So we're going to be looking at our values, our beliefs, and our social norms, right? And then data gathering is when we're going to be able to get information. So we can go check out the age, the race, what health organizations we have in the community. Right? So those are really important two differences that we need to know. When we look at a windshield survey, this is what you guys are doing for your vulnerable populations. We're going to know that we are looking outside our window, but before we look, we have to know what our boundaries are to ensure that we are looking at the right community. Okay, so we're going to look at those kinds of things. Make sure you have your boundaries set so you know what they are. Evidence-based practice we talked a bit about in class. You're going to have different practices that you work with and know that our goal is to improve client outcomes as well as nurses' outcomes. But the first step that we have to do is to recognize what are we doing presently and believe that our best outcome will lead to improved client outcomes, okay? So there's the barriers that we see when we try to implement stuff like nurses don't want to embrace it and they don't know what's the research behind it and the evidence, okay? So we're going to look at those kind of things when we're doing evidence-based practice. Emergency preparedness guide. We covered this tonight. They're either natural or man-made. So our natural ones are going to be those that are naturally occurring, like our earthquakes, our epidemics, our droughts, our hurricanes. Man-made disasters are going to be events that are directly human-related, like pollution, warfare, fires, and water supply contamination. Right, so we have those two there. We talked about our disaster kits. When we're preparing for a kit, the nurse should instruct the family to get enough food for 3 days, review the kit every 6 months, ensure all members of the family know where the kit is, and how to turn the utilities off. Okay? Make sure you check those kits every 6 months. Make sure nothing's expired. Purpose of a mass casualty is to evaluate how much time it takes for an emergency response to be activated. So we always want to try to improve that. So early response systems can decrease casualties when we increase what's available. Skip that one. All right, when we're teaching, when we're creating a project or doing something, when we're developing a community-based education program, we know that we have to develop it for the population for which we're teaching. So we identify the issue, select the learning theory. Is it cognitive based? Is it affective based? Is it psychomotor based? And then choose our teaching strategy that we're going to implement. We look at the 3 different domains, which we saw are affective, our cognitive, and psychomotor. We know cognitive is our brain, affective is our feelings, and psychomotor is our skill. Can we do a skill? When we're teaching, we look back and say, did we use that teach back method to evaluate if the learning was effective? Okay, it focuses on having the client redo whatever we've done to demonstrate what was taught. Okay, so we do that with skills, like for insulin, we'll have them show us what they learned. When developing an educational program, make sure that the message is very clear so that the people you're teaching to know what you're going to be covering. So limited number of points, use an active voice, handouts and posters are always helpful. And the nurse should use stories and examples, okay? So that's why in class we always go through examples so that it sticks in your head a little bit. We look at malpractice, which went with our ethics chapter. So in order for something to be malpractice, a doctor-patient relationship must exist. The doctor must be negligent. The negligence causes direct injury, and the injury leads to harm. Okay, so these are your 4 things when you're looking at malpractice. You make sure that all of them are applicable. When we look at malpractice, this is a liability when the 3 conditions are met. Okay, the provider had a duty to provide care, a breach they didn't act where they were supposed to, and it caused injury or damage. So case managers always have to look at that and see where that happened, and they may have to adjust based on that. Remember, negligence will be there's something hurt. Healthy People 2020 and 2030, national effort to improve Americans' health over quite some time. So we are looking to have a high quality life and live longer. We have 2 organizations that really help us, the World Health Organization. And the services that the World Health will do is look at drug reactions, vaccine standards, biomedical research, providing information on internationally occurring diseases, and having the collaboration among our countries. We also have NIH and CDC. So our federal agencies make sure that you are aware that the Agency for Health, Care Research and Quality is responsible for the quality and safety of healthcare. Center for Disease Control monitors health, detecting problems and preventative strategies. Our HSA is going to improve health status by providing education to our healthcare providers, and the NIH is going to be biomedical research. So these are a bunch of different systems, and I want you guys to know those. We talked about case management. We know that we have a lot of different roles. When you're a case manager, be sure you're responsible for helping and being individualized to each patient. So when we're looking at advocacy, we're going to follow the nursing process. We're going to assess and diagnose, right? through exchange of information, gathering of data, and highlighting values. Nurse case managers work to meet the health and well-being of clients through coordination of care. Healthcare providers such as nurses, physical therapists, and dietitians have specific roles. Nurse should report any information to their case manager that requires coordination of care. We want to remember for our home equipment, for our ABCs, right? Airway, breathing, and circulation. And remember, in rural areas, you may need to coordinate the transportation. We take a look at infectious diseases because you guys had a whole chapter last week on that. Vaccines are one of our most effective methods of controlling it. We know polio, pertussis, and measles has been lowered, although we're seeing it back again. So children may need to be immunized. Remember that I want you to know the side effects of like our Hep B vaccine and a DTaP vaccine for our kids. We look at STDs, which was part of that chapter. We know virally, we have HPV, herpes, and hepatitis. Bacterial, we're going to have chlamydia, gonorrhea, and syphilis. Our syphilis, we know, crosses the placenta. So these are going to be big concerns if you're pregnant. Let's see. No, for our Lyme's diseases, that's another one that's spread by ticks in heavily wooded areas. So be sure you know that. Vaccines are our best prevention. DTaP, we look at it's normal to have swelling and redness at the site. We oftentimes use an ice pack for this. Hep B, do not give if they were allergic to the first one. That's very important to remember because it's a series of 3. Observation and surveillance, we talked about where we collect stuff and get data to monitor our disease trends. The purpose of our surveillance is to reduce morbidity and mortality. We're seeing what's going on, but not eliminating all our community-based infections. So here we take a look at like RSV, influenza, and influenza B. We looked at a chart here and that's how we can survey it over time. We have 2 systems with our surveillance systems. We have our passive system, which relies on healthcare providers to report anything, and our active, where the health department goes out and says, have you seen any of these cases? And then they watch that. Okay. The syndromic system is going to focus on real-time data using an automated data entry system. So it's an easy way to do it. Patterns of occurrence, when we look at outbreaks, I would like you to know all of them. A point source outbreak is when all people exposed to a source result in each person getting ill. Intermittent is when we're going to get exposed to something over a period of time, and then people get sick at different times, like food poisoning. We have a mixed outbreak when one person is exposed to a source, then person-to-person contact, such as influenza. That'll be your mixed, and then your propagated outcomes do not have a common source and spread gradually from person to person, such as TB. What else do we have here? We know we're always doing our ADPI, our assessing, our diagnosing, planning, implementing, and evaluating. And how are we going to evaluate a program's effectiveness? We're going to look at the long-term changes in a program to see that. Continuous quality improvement, we spoke about this tonight in class. We know it's structured approach to improving performance, focus on preventing and identifying quality assurance by detecting if errors occur. And if they do, what are we going to do for new procedures? And as we spoke of, you need to make sure in that first phase, before you start making changes, you decide what everybody does, right? We talked about what the secretary does, what the nurse does. You have to really clarify those jobs descriptions. So we are always looking for quality improvement to improve customer satisfaction and have our staff aware. when we have different phases of a quality improvement program. So the first phase is the structure phase. And this is when we figure out who does what and does the philosophy align. Then during the process phase, the nurse evaluates the quality of care, and then the outcome, they'll evaluate the quality improvement by client satisfaction and health indicators. We looked at ethics tonight, and we know our different principles: autonomy, beneficence, non-maleficence, justice, treating everybody fair, and utility. And so we want to look at the ethical principle of beneficence is about minimizing risk while maximizing the benefit. And justice is making sure everything's fair. Utilitarianism is also going to be part of our ethics, that the outcome is key, so the action must justify the means. So what you're doing must make sense to come to your outcome. We talked all through our class about our immigrants. Think about some of the things that they are facing: financial, language, differences in social, religious, and cultural backgrounds, lack of a healthcare provider, family conflict, and changes adjusting to a new culture. With our different cultures, we know Native Americans are going to be our past oriented, and they may not be concerned about the future. So if we instruct the client to call in 3 weeks, that is future oriented. So the nurse should schedule the appointment so that she has specific instructions for that Native American. When communicating with clients who are Hispanic, know that we don't use negative expressions. We use direct eye contact and physical communication. We know about our Amish culture, which is going to be those natural and alternative treatments are common. Church is important. Organ and blood transfusion is not prohibited. And the male is the head of the household. So he's going to make all our decisions. Okay. So that ends us with culturally. Let's see, I have one more little, oh, that's just some math, but I'm not going to go over it. Okay. Any questions on our review? Multiple choice, 5 math. No? All good?
No, I have a question. Just couldn't get here fast enough.
Okay.
You know that quality, is there going to be questions on that quality and assurance?
Quality improvement.
Yeah. I'm a little fuzzy brain about that.
That's okay. So quality improvement is just making your practices better, right? So like the example I gave in class was getting a better computer system. So it's quality improvement. So it's trying to improve your quality of customer service. So what happens with it is there's a couple different phases that you go through, right? Before you make a change, you got to figure out what everybody does. That's the first phase. Identify what do they do and how does that implement in the practice, okay? And then once you start making changes, you're going to go through it and see how that works. And then you're going to look at the end and say, did anything I do help?
Oh, okay.
Okay.
You know,
That's really your quality improvement.
because there was a question. What is the difference between in the quiz? What was the difference between quality and QUIC? Something different.
Okay, let me look at the quiz real quick. I know exactly the question you're talking about, but oh, I don't know if everyone's taken it.
Oh,
So I don't know if I can go over it.
okay.
But let me just look at it for our
But then
review.
there was the passive, yes, was it passive,
And
um,
active, yeah,
active, and
surveillance.
mm-hmm. And I made a mistake. One of the questions, um, I'm going back to it. So anyway, one of the things that I wasn't sure was that was this a sort of type of secondary prevention?
Well, quality improvement.
No, the
Oh
practice.
no, so passive is when, depending on, let me just look at the question really quick.
Okay.
How does quality improvement differ from quality assurance. So quality improvement is going to be, what are we doing as a community, like as a hospital, as a nursing home, as something like that, so that we can get it better. Quality assurance is just when you're dealing with just the patient care. So the point of quality improvement is to improve the whole organization so that ultimately the client's happy. So you understand the
Okay.
difference? One focuses just on the person and one
So
focuses on the
going back
organization.
to the computer and the software.
Yeah. Mhm.
Okay,
Right.
all right.
And then let me look and see what the
Well, I was gonna talk about the three different, um, uh, what was it? Passive, um, I don't know why it's the only one I can remember.
passive
But
and active.
yeah, are we gonna see questions on that? And what is that?
Yeah. So
My
passive
question,
is what, go
my
ahead. So
question
you
was
have
about
passive and active
secondary.
surveillance,
Yes.
right? And so that's one thing we talked about. And then you have passive and active surveillance, where we look at and observe, right? And so surveilling, we're looking to see what's going on, right? We're surveying, we're looking around what's going on. So when we do that, we can either do it by having all healthcare providers, like the example I gave in class was like during COVID, if you had a COVID positive patient, you had to report that to the health department, right? As a provider. The
Mhm.
active system is when the health department goes out and calls them and says, hey, did you have any of these cases? Or they can use like a data entry system where they'll send it and then your provider will input the data so that they can figure out what's going on. So you either have a system where it's quiet and the healthcare providers come and report the cases, or you're active, you got to go out there and get them. So
So
think
that's
about,
like door to door sort of information.
yeah, it's not going to be door to door, but yes, if you, I mean, back in the day, yeah, it would be door to door.
Yeah, okay.
Okay, does that
That
make
was,
sense?
yeah, that was a little confusing, but yeah, now I see, because passive is when the they gather information from the doctor's office.
Well, so they don't even have to gather it. They don't have, they're passive. So passive, the word passive means sitting back. So they
Okay,
sit back and they wait for the providers to give to them, right? And then our
okay,
active ones, you're gonna have to go out and get the data. So it's just
okay.
think about active, like, when you're active, you're physically active, you're moving around, you're going and doing stuff. So this is the same kind of thing. You're going out and getting the data.
So am I reading too much into by calling it secondary and all that?
Yeah.
Okay,
Yeah. Don't even think about it.
all right. I'm overthinking it. All right.
Yeah.
That is all
Any
my,
other questions on the content? No? All right, this is your third exam, so I wish you the best of luck. Please make sure that you review with other professors. They do different types of exam reviews than I do. I do content based, so I just go through the content, because what I recommend to people is listen to it again and again. I'm sorry if you have to hear my voice multiple times, but that way you'll hear the content over and over and over, and sometimes that's helpful. Okay, so have a good night to everybody. I will send this recording to your professors, and if you have any questions, you know how to get me.
good night. Thank you.
Good,
Thank you
good
so much.
night. You're welcome.